Welcome to the show this afternoon. We are looking at the third National Health Financing Conference that has been ongoing under the theme Harmonizing CSO Advocacy for Adequate National Health Financing. Now, health financing has three main functions. We do have a revenue mobilization and collection. We are looking at risk pooling and also resources allocation. Now, for the last decade, Action Group for Health, Human Rights and HIV and AIDS. In this conversation, you hear us use AGA in partnership with other CSOs, have engaged the Ministry of Health and the Parliament of Uganda through a concerted effort to advocate for increased health financing. So today we dive into this conversation, further to understand the current status of the health financing and how best the CSOs can make this possible through what they advocate for. Now, for you who's joining us all online and also live, we do want to remind you that the hashtag on our social media platforms is Health Financing UG 2021. So in case you have a comment or you want to be part of the conversation, you can be right there and use this. Now, we are joined by Honorable Jonathan Ebwalu, who is the Member of Parliament, Soroti City West, who is seated right next to me. A very good afternoon, and thank you so much for joining us today.
Good afternoon, viewers. I am very happy to be here to make a contribution for the development of our country. I thank you. Great.
We also have Peter Echeru, who is the Program Specialist, Health and Human Rights Advocacy at the Center for Health, Human Rights and Development, CEHAD. You'll hear us, of course, mention that in our conversations. You do have 8 years of experience in advocacy work. We're excited to have you on the platform today.
Thank you so much. My name is Peter Echeru. I work at CEHAD, and I'm glad to be here.
Great. Now, a big thank you to all our sponsors who have made this show very possible. We do have CEHAD, Living Goods, AGA, and of course PATH. And we just want to right away dive into this conversation. It is coming at a time when the country, like many other countries really, are still battling the COVID-19 pandemic. It was a crisis. It came, we're not ready for it. And I do want to start with you, who has been in advocacy work for the last 8 years. Would you say the current status of health financing is being prioritized at the moment?
That is a complex question, depending on who you speak to. If you speak to other people, they will tell you yes, because we've seen a numerical increase in the funding to health. We've seen a number of growth in the health sector. But if you do a more serious analysis into the health sector financing, you come to a point where you say, I think we've not done as a country what is enough for us as a country. We've seen an increase in the budget over the last 8 or so years, moving about from 600 billion to now over 2.5 trillion shillings. And that's a good progress. But the question is it adequate? If you look at the budget increase over the years, if you look at inflation, if you look at the population increase we've had as a country, is that adequate? And our answer is that when you do that deep analysis, you realize that not yet. We've not yet reached that point where we can comfortably say, yes, we've arrived. But the reason, if you really want to see the practicalities and the realities of health financing, just go to any village health center too. You'll not find medicines. You may not find staff at the facility. Those are challenges that everybody goes through every day. So those are things that determine, that show you whether there is adequate financing or no. You'll go to a lot of health facilities, and the biggest challenge is in terms of medicine. People go to a health facility, there's no medicine. When NMS brings medicine, it lasts for 2 weeks and it is finished. You go to a health center for where a mother goes to deliver, and they actually don't have blood just in case of any emergency operation. When you look at statistics in terms of health workforce, the number of doctors, nurses, and all these people who support the system, you'll notice that we have never hit any of our targets in terms of human resource for health. We are all actually, in the last financial year, we even regressed. Our target was to achieve 80% funding. I mean 80% of approved positions in the health sector field. We moved backwards. We are not even making progress towards achieving what our targets are. So that points to you to the fact that we do not have enough resources to ensure that we have adequate resources for health financing. And that's the area we want to look at. If you look at financing itself, people who work in health facilities can just do as much as the resources they have can help them do. So if, for example, NMS does not get adequate resources, they'll just buy as much medicine as the money they have is capable of buying. Health Service Commission will recruit as many people as the money they have to pay those people.
Well, maybe just to also pick your thoughts
Yes.
from your experience again, what are the main challenges that you usually see in when people are looking for funding to the health sector? Where is the bigger problem?
Areas to fund.
Yes.
One of the most important things that we need to think about is medicines in hospitals, because functionality of health facilities depends significantly on availability of some of those things. As a country, we
What
have...
about how they're used, how they are
used.
appropriated?
That is the secondary now. Once you have the medicine, then you can determine how they are used. In this country, our medicine, if you go, for example, to Health Center 2, they only receive about 38% of the medicines that they need, according to NMS.
Yes.
The medicines they receive is not adequate. Now, as a country, we have done well in terms of taking health facilities nearer to people.
True.
We now have 86% of our population living within 5 kilometers of a health facility. That's good. That is achievement. What is lacking is the question of functionality of those health facilities.
Let us now pick the thoughts of Honorable Jonathan Ebwalu from where you sit again, and if you're to look at the national budget and the overall population growth amidst the COVID-19 pandemic, do you think health financing is being prioritized?
The answer is no. As I start, I want to thank the President of Uganda, who is the head of the executive and head of this government. I want to thank the Parliament of Uganda. At a policy level, we have tried everything possible to increase the health budget, but it is not enough. Let me tell you now, the budget that we passed just a few months ago was 2.57 trillion shillings. But that's a drop from the budget of 2020-2021. There was a drop. Now, as a country, we have a huge population. The number is growing by day. Now, the last time we had our budget, the percentage of our national budget got to 11.2% was way back in 2004. But as I speak now, our budget has come back, national budget for health has come back to 8.3%. So this is way far below the Abuja Declaration, where we as a country, as government, we committed that would be contributing not less than 15%, at least minimum of 15% of our national budget to fund the health sector. But that said, I want to say government has done what is possible, but there is a big problem. We still have a number of gaps in the health sector. COVID exposed us as a country. COVID exposed us as a country.
Our readiness
I
to
was,
tackle crises.
yeah, I am privileged to serve in the parliamentary committee on the task force of COVID. We moved all over the country. But let me tell you, COVID exposed us. COVID found us unprepared. Unfortunately, after the first wave, we did not learn anything as a country. The second wave came. Even if the third wave was to come now, we are still at the same time, at the same pace that we were 2 years ago. Now, you will go to our hospitals and find, one, we don't have enough doctors in our hospitals to manage the growing population. Two, we have poorly equipped hospitals, as I speak to you now. A hospital like Soroti Hospital, we do not have a person who is called an anesthesiologist, a person in charge manning the intensive care unit. We don't have in Soroti. Now, we asked the ministry why we don't have such a critical person. We failed to pay them. The advert was run, people did interviews. Now, when it came to paying them, we failed to pay them as a country. A number of them went to Kenya, they went to Tanzania, they went to Rwanda. Each of them, they were asking for 400,000 per day. So that means in a month, that would be like 12 million shillings. But if we're committed as a government, we would have paid that money to save our people. Now, we have, when this COVID came, the government delivered the ICU equipment to Soroti, but we don't have a personnel, we don't have a qualified person to man it. It is idle in Soroti. That is on the area of equipment. Area number 3, we don't have sufficient drugs in our hospitals. Even now, the people who are sick, who have the COVID, most of them buy drugs from the private clinics. They buy drugs from the private facilities. Now, NMS tries as much as possible to deliver the drugs and the PPEs, but they are not sufficient. They can deliver today, like my brother said, after 2 weeks, they are finished. They will take another 4 months to deliver. That exposed a number of our doctors to this COVID pandemic. A number of our doctors got the virus because they did not have the personal protective equipment. Now, that also caused some death because some of the doctors now feared to reach where our people were, the sick people.
Yes.
And that made some of them even to die. In Uganda here, we lost over 53 health workers. Some of the situations that were surrounding the death could have been managed. That is on the area of drugs. If you went to our hospitals now, some of our hospitals up to now do not have even oxygen. Oxygen. I tell you, oxygen. But you find most of our people, like me, I am now a privileged citizen. If I fell sick now, the speaker can order, I can be flown to US. I can be flown to China. I can be flown to UK for treatment. What about you? What about my voter in Kamuda? What about my voter in Kapelebiong? What happens to them? What we need to ask government is to deliberately come out and fund the health sector. One, if people fall sick here, the privileged ones, they are flown to get treatment abroad. But some of them have died there. Very big embarrassment to the country. Now, when you take a person like a member of parliament like me, you take me to get treatment in a Aga Khan hospital, you are simply showing the country that you do not have faith in your own hospitals. When me, a member of parliament, I take my child to study in a private school, that shows that I don't have faith in our government schools. So a number of our people do not sometimes care about the health situation in the country because they don't go to these hospitals. But I want to thank COVID, let me tell you. I want to thank COVID. COVID came, we all went to the same hospitals. Some of them were lucky that they did not get COVID, or even if they got COVID, they were able to get treatment in private clinics. If we didn't have private clinics, we would have all died in the same hospitals. So as government, I think we had some lessons to learn from COVID. We need to stock our hospitals, recruit doctors, equip our hospitals, make sure we improve the payment of our doctors, the payment of our nurses. We must ensure that we improve on their housing. Let me tell you, if you went from here, you want to do consultancy, maybe you have a broken leg, and you go from here to Zambia. A person you'll meet in Zambia is doctor in the whole of sub-Saharan Africa. The best orthopedic doctor now that we have is Dr. Kure. If you left here that you're going to get treatment now in Zambia, in South Africa, where you'll meet Dr. Kure. Dr. Kure is from Kumi in Soroti. Now, it is not that our doctors are unable. Our doctors are incapacitated. We don't have enough equipment that our doctors can use in the hospitals. Let me tell you, there was a very interesting situation where there were 2 babies, twins, they were born. Then one died. It needed now operation to save the other one. They came up to Mulago Hospital. Mulago Hospital condemned them. That family was sent back to Amuria. They condemned them that they couldn't do much. A man called Dr. Epodo Joseph from Serere working in Soroti Referral Hospital.
You remind me of that story.
Yes,
Yeah.
a man called Dr. Podoi, trained from Uganda here, Makerere University,
Yes.
said we are going to do everything possible to save life. Remember, one was already rotting away.
Yes.
Now we needed to save this one. Mulago, a national referral hospital that should have been able to help us, condemned that child, sent back to Amuria. Dr. Podoi, Dr. Jiko, Dr. Tolu, a team of doctors came together and said we are going to save life. They risked. They took the child to the theater. They operated, removed the dead one, and saved this one. That was in Soroti Hospital, assuming now they had the sophisticated equipment that we have in Mulago. It is not that our doctors are ill-trained. We have well-qualified doctors here in Uganda. The problem is we do not have the equipment that they can use in the hospitals.
But also, where do you think the bigger challenge is? Is it the lack of a clear health financing policy?
No, some of
that guides
the things,
the entire health sector.
Some of the things, even if you pass the policy, like now, already we passed the policy. Even if you pass the policy, it takes a commitment from government to do that. It takes a commitment from government to do that. Let me tell you something. As I speak now, the budget of security in Uganda here is 7.7 trillion. That is 30.4% of the national budget.
Yeah.
Now, if we, then there is what is called classified budget. Now, with the classified budget, it's very interesting. You even don't account for it. The way it is used, it is only those who have it. You even don't need to account for it, the classified budget. So we are saying, as a country now, security is very important. We know that security is the anchor of all these sectors,
yeah.
all these departments. We know that it is the security. But even as we invest money in security, we must also be thoughtful of our people. Because if you have a sick people, whom are you going to guard? Whom are you going to guard? You can have all the monies to put in the security, but if you have sick people, how are you going to help them? So as a parliament, we are going to do what it takes us. Me, as a member of parliament, I sit in the Committee of National Economy. I served in that ad hoc committee of the Parliamentary Committee on COVID. I am allowed to sit in any committee of parliament as ex-officio. Yesterday, when I was interacting with my brother and a number of my friends here, I made a commitment. I even rang the chairman of the Health Committee and said that we need to do what it takes us. If it comes to the floor of parliament, we'll support you. But later, because now we're in the budget cycle, it's a good thing now we're in the budget cycle. We're going to ensure that we push the money. At least if the money can go, even if it is 10%, and then we use it well. Sometimes also the problem is, in Uganda, we lose over 1 trillion shilling every year to people who steal with impunity. Now, even if we're going to invest money, we must ensure that the money that we're investing as a country is utilized well. There are people who have completely lost the sense of shame. They steal our money with impunity. They don't care anything. Here in Uganda, they don't care anything. COVID has now made people very rich. People are now buying markets, people are buying houses, people are buying land with COVID. Let me tell you something. As Parliament, we discovered that already we have spent 4.4 trillion shillings managing Corona from the time Corona broke out. Already we have spent 4.4 trillion shillings. But you know, when we interact with the Minister of Health and the Permanent Secretary, they told us that we need 2.7 trillion shillings to have all the eligible Ugandans, the 23 million Ugandans vaccinated. But already we have spent 4 trillion in what is not clear, managing the curfew, managing the what, managing the what, managing the what. Now, if as a country, we said here is 2.7 trillion shillings, let us have the vaccines bought, we will be able to solve this problem. Because the only solution to the problem that we have now in the country, the lockdown, we have locked the country, we need to have the country open, but our people must be vaccinated. Our people feared the vaccine in the beginning, and I think it is because of, you know, there was a statement that the president made jokingly, But as the head of state, people follow what you say. I think the president said that, okay, we have a number of vaccines, but I'm still studying which one I should take. Now, I think some people also listened to that very careful, and they took it very serious.
They truly
that
did.
If the president is still studying which one he's going to take, then whom am I to rush to get the vaccine, to take one of the vaccines? But I want to encourage my people. I have got both shots. I saw the president the other day demonstrated. The president #1, President Museveni, has got his shots. Now, for you who is out there, if you're still asking that which one should I take, that should not be a question. The question should be, where do I get it? Some people even want to be carried. They want government to carry them to go and get the vaccine. You move to the nearest hospital. As parliament, as government, we agreed and said, let us set the primary schools to be the vaccination centers. For those who cannot move out of the mosques, let us follow them in the mosques. For those who cannot move out of their churches, let us follow them in their churches. Let us follow people in the markets so that we have...
Find them where they're most comfortable.
Yes, let us follow them.
Yes.
Okay? So that we make it easier, have our people vaccinated, and have the economy fully opened. A number of businesses are going to be closed because of this. A number of people will never go back to school. Most private schools are going to close forever. Now, as I speak, in 1 year alone,
but the president did promise that come January, all sectors of the economy are going to be opened, whether we are fully vaccinated or not.
No. The president was very clear. The president said that by December, we should have vaccinated the 23 million people. Now, if we do not meet that target, it is going to be very difficult to open the schools. Very difficult to open the schools. But what I'm saying, we have had a number of diverse effects out of the COVID.
Yes.
Most of our children have got pregnant now. Most of them will not go back to school. My son is now taller than me. He was in Teso College. By 2019, he was in senior 1. He would be in senior 3 next year. He's now even taller than me in senior 1. Because now this is the 3rd year he's going to senior 1. I don't know what we are going to do to manage that. The minister was saying we need to push our children, the automatic promotion. But the automatic promotion, we tell the ministry, that can only work in a few schools in Kampala. Because you can get a child in primary 6 in Kampala here, maybe Kampala Junior School, maybe where Gayaza, you can get a child in senior 5 or senior 4, can go and sit senior 6 and will pass examination. Here in Kampala, a few schools. What about now in Ogongoja? What about now in Kamuda Primary School? What about in Omodo Primary School? They cannot pass there. They cannot pass there. So that one there is going to bring a bit of a there will be no equity in that. So I don't know how the ministry is going to manage that. But by and large, I want to encourage our government that let us make health accessible, affordable, and quality health to everyone in Uganda. Because every life matters.
True.
The life of President Museveni, my life, your life, his life, and a pure peasant who even fails to eat in the village there, his life matters.
Now, from your very opening statements, we can all agree that the health sector is not doing so well.
Agreed.
However, I want Peter Icheru help us understand those specific areas that are grossly affected.
Okay, one of the areas that is facing lots of challenges relates to maternal health. You've seen that our statistics show that Uganda probably has some of the highest maternal death rates in Africa. And that is because of shortages that are within the health financing systems. I'll give you an example. Blood. Statistics actually show that most of the women who die are connected with loss of blood, hemorrhage.
Yes.
But when you get to health facilities, they are not able to provide blood. Now the problem is that we give little resources to Uganda Blood Transfusion Service. They are not able to collect and process blood that is adequate for everybody. So a lot of times you go to a health center they don't have a fridge to keep blood ready for use. So that's one of the biggest problems. So what the health center force do is to ask for a referral to a higher health facility, maybe to the district health facility. That delay between a health center 4 and a referral is where the death comes in. Ministry of Health staff will tell you that women delay to reach health facilities, and by the time they reach health facilities, the situation is so bad to manage. But that is partly because our referral system is not working. They were not able to get blood where they should have got help initially. Okay? So now you have to travel some 30 kilometers to look for a district hospital. Remember that in the village, the most common means of transport would probably be a bicycle. Now you're going to transport this woman from a health center for 30 kilometers looking for a district hospital just for blood. And that's where the problems come in.
I remember, just to come to you, most of our health center force were elevated to district hospitals, but they are still running with a budget of health center 4. For example, Katakwi. When we reach to Katakwi, they are still running a budget of health center 4, not a district hospital, so all that affects our people.
Yes.
So carrying on with the areas that are grossly affected, you bring in maternal health leading to so many maternal deaths. Really, where is the bigger problem? I'm still trying to understand and helping our viewers understand. Is it the government failing to prioritize health, or is it the failure of putting the little resources we have to proper use? You see,
a lot of times we argue that as a country we are broke.
True.
Our argument is that that is not necessarily correct. The question is about what are our priorities as a country. Is health one of them? Because the way you prioritize is determined by, is reflected by how much resources you put. If you look at government documents, health is one of those sectors that government has prioritized. But the problem is that it is prioritized in paper. That rhetoric is not matched with allocation of resources. That is where the problem is. So now when you need blood, for example, in a health center 4, you need to buy a fridge, for example, for that facility to keep blood. Now that money is not there. I remember 2020, 2021 financial year. Ministry of Health wanted to buy fridges for a number of health facilities, health center 4s. But you know, they didn't have money. And so it passed off as unfunded priority. That means those priorities that are key, but the government has not provided money for them. So the question is not that we have little money as a country. The question is, for us as a country, what do we prioritize? Is it health? Is it life? Is it security? That is where the problem for us is.
Well, for those that are watching us this afternoon, you can be part of the conversation on our social media platforms. Do send us your comments using the hashtag Health Financing UG 2021. How do we ensure proper health financing, and how do we see that the resources that we've gotten can actually be put to good use? Now, carrying on with this conversation, do you think the increase in health financing will lead to proper use of this money in this country, and how do we navigate that?
Like I said, as a country, the money we have, Uganda is a very rich country. We are a very blessed country. Even without donor funding, we would be able to fund our own budget. The problem is, most of us, we steal this money even when we are given. Now, I agree that there is a shortage of funding, I agree. But also, the people who use this money, they steal this money. Let me tell you, National Medical Stores tries as much as possible to deliver drugs to the hospitals. But when you go, I want to give you like Soroti Hospital, the referral hospital. When you go starting from the gate, where you're going to park your bicycle, money. When you go inside, sometimes, you know, there is this, the black paper, that black polythene paper. That women, you know, they lay it on the bed. Most times they ask our women to buy. But remember, government is supposed to provide that. Most times they ask our women to buy. Now the question is, NMS delivers, all right, but not enough. When you move to see a doctor, you'll see a doctor. What the doctor will do to you is to tell you, you go to the pharmacy. You'll go to the pharmacy, the only thing you'll get in the pharmacy is what? Panadol. Is Panadol in a pharmacy? If you're lucky, you'll get Coetem. If you're lucky, you'll get amoxicillin. Now you have to walk and buy in the pharmacy. So these are the problems that we have. That we have a huge population that is growing by day, but the budget is either stagnated or even going low. So we want to ask government that before we ask how money has been spent. Let us first put money. Then we go and follow how the money is being spent.
Now,
But
he
let's
did
first
mention the area that he feels is mostly affected by limited health financing. Let us now hear from you, from your interaction with different members of parliament, and also Soroti as well. What are those areas that you think are grossly affected by limited health financing?
I agree with you. Like you said, you walk now to Soroti, the women ward, the maternity ward. You walk to the maternity ward. There was a time I walked to the hospital, I cried. They were in a theater. In a theater, power went off. At that time, we didn't have a generator. They were using a torch of a phone when they were carrying operation. There was a breakdown at that time, power went off, there was no generator. That is the time Captain Mukula had to offer there his personal generator in that hospital. It worked for some time. But I'm happy now that that problem has been solved. That problem now has been sorted. So there is a big problem in the maternity ward. Our women cannot afford. There is a medicine called gometrin. I think that one is used for stopping the blood. Yeah, I think it is used for stopping blood. There was a time we didn't have it in Soroti Hospital. Not because the doctors were not there. Doctors are there, but we didn't have what was enough in the hospital. I want to say we have a big problem, number one, in the maternity ward. We have a big problem when it comes to the area where we get the blood, the blood bank. The blood bank. We now have a store, actually I call it a store in Soroti, but our blood we pick from Mbale. Now we have asked government that we need to set up a full blood bank in Soroti. And I'm happy that government has accepted and is taking this up. We are going to build a full hospital in Arapai sub-county headquarters. They are going to build, it's going to be a referral hospital. They're going to build in Arapai. Once that is set, I am sure it is going to solve most of this problem, because the equipment that is going to be put in that hospital, equipment that we can find in Chirudu, that we can find in Zambia, that we can find in Mulago Referral Hospital. Because I ask myself, why would we refer a person from Soroti to Mulago Hospital that we cannot put in Soroti Hospital? Can't we put the equipment that we have in Mulago in Soroti Hospital? We can. Can't we put the equipment we have in Soroti in Arua, in the equipment we have in Mulago Hospital, in Arua Hospital? We can. The problem, like we said, is commitment. So we need to improve in our maternity wards. We need to improve on the blood bank. In the blood bank, there is a big problem.
I want to bounce back the questions to you.
Yeah.
I want to bounce these same questions to you. The same question to you. The critical areas that we need to focus on as we speak of health financing.
One of the areas where we have a huge challenge is in the area of maintenance. They call it operation and maintenance of equipment, especially. We have a lot of equipment in this country, but most of them have broken down and they cannot be repaired. Just go to Naguru Hospital here. They will tell you they don't have an X-ray machine. They will tell you they don't have a scan. They have, but they broke down and they do not have money to repair. I saw a story, I think, somewhere in Tororo or around that area, where their scan had been broken for over 10 years. There are no resources to repair them. And I think... brings in the aspect of commitment, like the Honorable mentioned. That you need to put money. I have seen some hospitals receiving only 5 million shillings for a whole year for maintenance of equipment. That could not probably even repair one machine. But that is the amount of money we are allocating to those resources. At the beginning of COVID, probably you noticed that most of the oxygen machines, oxygen plants across, either were broken down or broke down shortly after COVID. It is because they don't have regular maintenance. I know that the latest oxygen plants that they are establishing have a warranty of 3 years, meaning that the person who has supplied and installed will manage them for the next 3 years, including maintenance. But we need to take deliberate action to ensure that the equipment that we place in these places are actually maintained. When they break down, we should have resources to repair them, because that's a big challenge. Soroti Hospital, I remember I sent someone there and they told me a whole regional referral hospital doesn't have an X-ray machine. Just an X-ray machine for a regional referral hospital, which is supposed to be the center of excellence.
Now, let me tell you, when we reached there, we put Dr. Mwanga to task to tell us why we do not have an X-ray machine. He said the one we had broke down. Then we said, now, where is the problem? Sometimes the problem is not the permanent secretary. Sometimes the problem is not parliament, not even the president. Sometimes the problem is the managers in these hospitals. And I think there's something that we are going to recommend in future as parliament. We have doctors who are trained. They are trained to be in the wards, in the theaters, but they are not trained managers. You see, a doctor is the executive, is the director of a hospital. I think we need to train in future, train a pure trained manager to manage a hospital, not necessarily a doctor. Because some of these doctors are not managers. They are doctors, they know how to be in the wards, they know how to be where, but they are not managers. A referral hospital is managed by a director, and a director is a doctor. But we can move out of that and say, okay, we are going to leave you to manage the medical part, but we are going to have a pure manager to manage our hospitals. That would do. The hospital, is the X-ray, I can confirm here, is broken even up to now. Dr. Mwanga told us, I have made a request to the ministry, but we have not yet got. I told him, have you made a request to repair the one that we are having here, or a new X-ray machine? He said both. Now, we don't know how far it has gone. I'm going to Soroti.
It looks like it needs a holistic approach to have a...
When you look at our theater now in Soroti, it is like a lockup. A theater is like a lockup. We need, first of all, this area, like Soroti Hospital, was built in 1944. When at that time, the people, the inpatients, were only 80. Only 80 people. We have not built more wards. We are still at the same wards. We have only,
the population is growing.
Yes. At that time, the inpatients were only 81. But now it is between 500 to 600. You go to the children's ward, you'll find children, one on top of the other, like potatoes. One on top of the other. But that is a hospital that we're having. Sometimes people are admitted. You're given the admission letter, the admission form to go to hospital. But you'll go, there is no bed. What our doctors do is to look at the patients, that who has improved. Let's discharge the other one. They put another person there. Who has improved? This one has improved. They put another one. Some of our patients, I say this without any fear of contradiction, are given admission forms but are put on the floor. On the floor in Soroti Hospital. That's the problem. I am not a critic of government, and I don't want to accuse government. I am part of government. But what I'm saying, for the love of our country, we need to improve on health, improve on the funding, so that we don't have such embarrassing situations in our hospitals. Let me tell you, our people are sent for CT scan in Mbale. Mbale, that hospital is called...
Masabawing?
No. It is Elgon. Elgon is a private hospital. But our people are referred from a referral hospital. You go and do a CT scan in Mbale, because we don't have a CT scan in Soroti. But Soroti is a referral hospital. Now, I asked one time Dr. Etolo that how much is a CT scan? To put it here, how much is a CT scan? So it takes us about 3 to 400 million. 3 to 400 million. We shall have a CT scan in Soroti. Now, that is not because we don't have the money. We have that money. But how do we get that money? If this is brought to attention of the permanent secretary, if it is brought to attention of the Minister of Finance, if it is brought to attention of the president, if it is brought to attention of parliament, that money can be availed and we set up a CT scan in Soroti. But as it stands now, some of our people cannot even manage to go for a CT scan in Mbale. What you do is you wait for your time. Sometimes doctors ask you, do you have the money for CT scan? And no money for CT scan in Mbale is 300,000. But if you're going to put a transport from Soroti to Mbale and back is another 200,000. So that is 500,000. Remember, this is a person who was brought to the hospital. You even failed to buy lunch yesterday in your home. But now you have been brought to the hospital. They need 500,000 to carry a CT scan. How do you manage it? So, holistically, we need to ask government, which I am part of, that we need to stock our hospitals with drugs. We need to equip our hospitals. We need to improve on our referral system. We need to improve on our equipment. General financing of our hospitals. It is very urgent. Not only important, it is very urgent that we need to stock our hospitals. We could cut some money from the security and then put here. I'm not a security expert. I do not know the threats we have in Uganda now, that we need more money in security than health. I'm not a security expert. But overall, even if we don't cut money from security, we can look for money from other sources. Then we fund our health sector. We need to have this money. For you are lucky. You can, if you fall sick now, NTV will take care of your treatment. What about the peasants that we have in Masaka? The peasants that we have in Barara, they cannot afford this treatment. Unfortunate now, the treatment, it is now from the pocket. If you don't have your money now, it is difficult to get a treatment. And that's why we need to improve on the financing of this system so that we stop people from using their monies to get treatment.
Now,
we need to have in Uganda here, I think we need to make it compulsory. Compulsory that everyone in Uganda must be enrolled on insurance. Enroll on insurance.
Just like we're seeing in other countries.
Yes, like in other countries, working in Rwanda and other countries. We enroll you on insurance. Someone can say that, to me, I will not fall sick. We don't care whether you'll fall sick or not, but your contribution should treat the other person.
True.
Your contribution should treat the other person. I think it is a conversation that we are going to have with the Committee of Health and have it in Parliament. I will have a private discussion with the Speaker of Parliament. I will have a private conversation with the Deputy Speaker of Parliament and see how we can bring this up. If we make it compulsory,
so in your own perspective, you
Yes.
think compulsory contribution to national, insurance will contribute to proper health financing in this country?
somehow it will be able to help in some of these gaps, because we want a situation where a hospital where Jim Wezi enters should be the same hospital you enter.
True.
A place where General Museveni enters should be the same place that you enter. So as long as you have what? You have a card.
Well,
and the card that we have should not be...
We should put the same to the viewers.
And
We'd like to hear from you.
Yes, okay.
Do you think if we put mandatory contribution to national insurance of every single citizen, do you think that will contribute to proper health financing in this country? I think it's a brilliant idea.
Yeah.
It is working for other countries, so maybe it could work for us. But again,
Yes.
the question of corruption would come in, how this money is being appropriated, how this money is being allocated to benefit the simple citizen that is deep there in the village that cannot fully access certain medical facilities.
You know how we can do it? We can say, okay, fine. You contribute this amount of money for this, like it happens in other areas. Even in the US, you see, if you are a HRO, if you cannot contribute this amount of money, you go to the middle class. You go to the first class, you go to the lower class. But then to me, I would oppose US. I would say we don't need to have the VIP insurance cards. We need to have one card that's uniform to everyone. Then we make it mandatory that we fund it. Now, how we could fund it? We
because
can fund.
Those
we can now
citizens that may not.
We
be
can
able
now
to
fund
contribute
it
to that.
according to our earnings. We can say it's mandatory. Members of Parliament contribute this. Mandatory civil servants contribute this. Mandatory you for the HROs contribute this.
Well, Peter Isher, what are your thoughts on that?
You know, the World Health Organization recognizes that health insurance is one of the ways of deepening health coverage.
Perfect.
So it believes that when you adopt health insurance, then you're moving closer to ensuring that everybody who needs health services is able to get it without necessarily breaking the bank.
Yes.
And you remember that Parliament, I think last year, passed the National Health Insurance Scheme Bill.
Yes.
And it went to the President for assent.
Yes.
It is one of those laws that the President did not sign, that the Speaker now says has to come back to Parliament.
And then this is it.
So we believe that until we reach a point where we are able to get health insurance,
True.
we will not be able to improve our access to health. So we think health insurance is important.
Yes.
But also you remember that when we passed the HIV/AIDS Control Act in 2014, we created what was called the AIDS Trust Fund under that law. And the idea was that there are these services that are provided, for example, in consumption of tobacco, they would make a contribution to the AIDS fund to facilitate HIV/AIDS treatment and all those related costs. That has never seen the light of day. So we are thinking that there are these small gains that we can make. Pass the National Health Insurance Scheme law that will enable people receive health insurance. If you look at East Africa, for example, Rwanda has done the best in terms of health insurance, and that has increased the coverage of health facilities in Rwanda. Kenya also has it. If you look at East Africa, we are the only ones who still do not have this. And if you look at health insurance coverage, for us in Uganda, it has refused to grow. Actually, before COVID, 4% of Ugandans had access to health insurance. And these were majorly people in the corporate sector. Those of us who are having insurance by virtue of your employment. Okay? When COVID hit and corporate companies laid off staff, number of people under health insurance dropped from 4% to 2%.
They withdrew their cards.
Yes, because now you had lost employment, that means you also lost insurance. And that's why it is important that we have a system that is national in nature, that will
can
save
benefit
you
so many
during the rainy time. Yes, whether you're okay or no. It has worked in other places. It will come with challenges, no doubt. But there must be a beginning point of how do we adopt? And it's
now, in regards to, as a matter of time, I
Yes.
want us to dive into the role of the CSOs, you know, in terms of health financing. What
Yes.
is your role? And for those watching us, once again, the theme is harmonizing CSO advocacy for adequate national health financing. What is your role in making sure the health financing actually works?
Our role, there are different categories of civil society organizations that we have. There are those that are direct service delivery, those that support health facilities. You, for example, have PATH that does a lot of advocacy around health, just like SEHAD does. But there are those that provide support. They recruit staff and place in some of these health facilities. By the way, if you didn't know, our health facilities, our health system is substantially financed by out-of-pocket contribution and then external contribution. If you put those together, it goes in excess of 60% of financing for the entire health sector. But for us who are doing health advocacy, our responsibility is to show government that there is a gap here. And this is what we need to do to solve this gap. To address the gap that we've identified. That is what our advocacy revolves around, telling government, okay, now probably health insurance is
From
the
your
way.
previous engagements with the government, when you point out these different issues that you feel need to be addressed, do you feel you always get the right response from the government like you would want it?
It is mixed. It is mixed, and it varies also from the technocrats in the ministry and then the political leadership at the ministry. I will tell you, when you engage technocrats in the various ministries and departments that handle health, you will be shocked at how they are so knowledgeable. They know exactly what we need to. But again, when you look at the political direction that we take, either at ministerial level or generally, those are the ones that determine the priorities that we need to do. That's why you will go and find that the Ministry of Health has a health financing strategy. Superb. If you read the health financing strategy on how we need to sustainably finance health in Uganda, you will think we are moving to the US. But when it comes to the implementation of that, in terms of resource allocation, that's where you find a problem. Technocrats in the Ministry of Health will tell you we need health insurance like yesterday. But the political leadership will tell you, no, it will affect the investors. The investors go and say, no, this is making the cost of doing business in Uganda high, so we think it is not a right time to adopt this. So you have that conflicting message between what the technocrats think is the problem, and they know it well. If you read policy documents of the ministry, you really appreciate that these people know what the problem is. The problem is that the prioritization which comes from the political wing is what is the challenge. If you look at, for example, the NRM manifesto, you'll also think that they know where we need to go. Actually, the NRM manifesto in 2016 to 2021 had actually said their commitment was to fill 100% of approved staff positions across the country. But in the 5 years, we dropped, we even got worse. If you look at their manifesto of 2021-2026, and the way it talks about health, how it talks about increasing universal health coverage, beautiful. But when it comes to the real walking the talk, putting the money in the right places, that is where we have a challenge.
That is where the problem
That is where the challenge is. And you remember, Parliament does allocation, or again, in terms of setting the direction of what do we need in the budget this year, it's also largely a political function. Okay? So once that political function does not move with a technical arm, then we'll continue to have challenges.
Now, as we conclude our conversation this evening, I would like to move back to you, Honorable. As we get out of the studio, you know, sometimes we have these dialogues. You know, what is the way forward? How do we ensure proper health financing, at least to increase it, but to see that it is put to proper use?
Even the budget that Parliament passed 2020-2021, not all of it was realized by the Minister of Health. Now, yesterday, the Speaker made a very strong warning in Parliament. The executive should stop meddling in the work of Parliament. Sometimes we have had the Minister having the explicit orders or the authority to even cut the budget. To cut the budget, Parliament passes, but then the executive goes, sits, and decides again to cut the budget to their priorities that they know. Our biggest problem as a country is that we have failed to know our priorities. Let me tell you, even with the money that we have in health, it is little, but if we're using it well, that money will do something. We steal this money. Even with the little that we have, sometimes I think government also gets reluctant that even if we put the money, they are going to steal the money. Indeed, they steal, but that should be secondary. We first put in the money.
Let's speak about the short-term solutions to the problems that we currently have.
No, we just need
to address the corruption tendencies that do exist within the system.
No, that is secondary. What we need now is first put the money. Once you have put the money, then you follow the money, how it is being used. We first need government to be committed, because our government, if government was putting in the 15% of our national budget to health financing, then it would now be easier for us to follow that. Now, government made its commitment. Government put in 15% of our total budget. But now the people who are stealing the money, we're not going to deal with them this way. But even the people who are stealing the money, they come and say, after all, government has not done its part. I think it is now only 7% or 8% of the total budget. It is far below the Abuja declaration. We want to ask government deliberately, in a very radical way, come out, put money in health. Like the president came out in 2016. In 2016, he made pronouncements and put in a lot of money on roads, on infrastructure, a lot of money. The president can do the same. Can come and say, now we are going to have a total shift in our budget, let us put the money in health, and that can happen. Also, I want to appeal to the president and government to stop cracking down on the civil society. A number of civil society organizations have closed. Most of the people who were doing a pretty good job in the civil society, they have opted to get out of the civil society. They are now running their own private work. Yes, they are not necessarily being critical, but they are pointing out where we have the gaps. But when they become critical, when they raise where we have the gaps, they are framed to be opposition. Me, I want to ask government that let us work together with the civil society. Civil society can do a pretty good job, not necessarily in the area of funding, but they can be able to help government to know where there are gaps. Then government can come in and then fund. But in conclusion, I want to appeal to government, I want to appeal to CSOs and our people who are watching the television now, NTV, that we need to start having a conversation how we can have these the insurance scheme, how we can have all our people in the country insured so that we get quality health.
Your very last remarks, Peter H.
My remarks are, closingly, I think it's important that we have a framework that's supposed to guide us on how do we finance the health sector. Let's do everything that it says, because part of the thing it says is that we need the national health insurance scheme. That's one of them. The other one is that government needs to progressively increase funding to a point where we are able to achieve increased funding for the sector. Those are all in our policy documents that we committed to as a government. So we need to walk that talk. One of the things that we have also committed is to reduce out-of-pocket expenditure, the money that people pay as they go to secure health. From currently, we are about 42%. Again, the highest in Africa.
That's the biggest financing now. That's
yes, it is now the biggest in terms of financing health expenditure. 42% from people's pockets. We spend as a country about 7.5 trillion catering for health in this country. But of that amount, about 42% is from individuals, households, and then the other about 30% comes from donors, and then the smaller percentage comes from government. That is where the problem is. And you see, if you don't deal with a question of health, then you'll have a problem dealing with the other issues, the other government projects of getting people out of poverty. You will not give someone a cow under OWC, and then they are seeing their child dying, and they will not sell that cow. True. When a child is going to die, the first thing that they will sell is that OWC cow, or the NADS cow, or is it the Myoga, wherever it comes. So until we reach a point when we'll accept that health is a social service, and that it is a responsibility of government, and that government has put in money, all the other development expenditures we are attempting to establish will always fail, because a single hit on a family by a disease will cause all these benefits from government to go off. And that's why World Health Organization insists that can we reduce that expenditure from the pocket to 20%. Actually, World Health Organization says if it goes beyond 20%, you have crossed the red line. You're going to start dropping people now into poverty consistently. So it is important that we think, we invest, and invest more towards primary health care. That helps people avoid getting more into a health facility.
Well, this is a conversation that we can carry on maybe onto our social media platforms. Thank you so much for sharing with us your thoughts. Peter Icheru, who is the program specialist, health and human rights advocacy at SEHAD, and also Honorable Jonathan Ebwalu, who is the Member of Parliament, Soroti City West. Thank you so much for joining us and sharing with us your thoughts. I can tell you still have both thoughts that you want to share.
Not just, we have in Teso, we had an old man called Achol Faustino. In his shop, it is written, Ajara Ngesabar. If someone is seated next to the president now, or the permanent secretary, kindly translate this to the president or to the speaker, that Ajara Ngesi Abar.
What does that mean?
As who are in the
It means, it means health is wealth.
Health is wealth.
Once you're healthy, you can be wealthy.
Absolutely. You've heard from them. A big thank you to all our sponsors that have made this show possible. SEHAD, Living Goods, Path, Aga. We truly appreciate that, and let us continue to reflect on just how much money we invest in the health sector, but also how much we put it to good use. And mostly, let us understand how we can enforce or put in place the National Insurance Scheme to say that every single citizen in this country can access health services at any single time they want to access them. I've been your host, Sandra Twinovideo.